14th November is World Diabetes Day. Take care of diabetes. With the help of your doctor, you can stay fit. Type 1 diabetes usually happens to kids because of some autoimmune process which damages the pancreas and the patient's ability to produce insulin is lost. These patients will need insulin lifetime. Very rarely you will find an adult with type 1 diabetes. On the other hand, type 2 diabetic patients are those who usually get diabetes because of their genetics, heredity, sedentary lifestyle, obesity, faulty lifestyle, junk food. This is what type 2 diabetes is. No symptom is the most common symptom of diabetes, because 50% of the patients suffering with diabetes will not have any symptoms as such. The remaining 50% who have symptoms may have polyuria, that is too much of urination, polydipsia, that is too much of thirst, polyphagia, that is excessive hunger. Sometimes they may have weight loss, unexplained weight loss, genital infections, disturbed vision, and there could be n number of other symptoms depending on what particular organ is involved. Exercise, lifestyle modification, diet, to something like insulin. There could be different type of medicinal treatment. There are certain medicines which sensitizes insulin. There are certain medicines which make your pancreas produce more insulin. There are certain injectable therapies like insulin itself or certain hormonal injections like GLP-1 hormones. So this is briefly what I can tell you about the treatment for diabetes. Contrary to the popular belief, insulin are quite safe. In fact, insulin is a natural body's hormone. So if it is used at a proper time, in proper doses, with proper titration, it's absolutely a safe hormone. So diet, exercise and lifestyle modification are important for prevention of diabetes. Eat on time, eat less, sleep on time, smile a lot and walk a lot.
Diabetes per se is hyperglycemia, which means sugar which is high in the blood. And when it is high in the blood, that means it affects every single part of the eye. You definitely need to take your medications even though you feel fine. But yes, please do follow the prescription that has been given by your doctor. A good diabetic control takes around 7 to 8 years for the diabetes to start showing up in the eye in terms of signs and symptoms. We have seen people wherein a diabetic controlled very well, patients with 30, 35, 40 years of diabetes which is well controlled, do not have any signs and symptoms and they're perfectly normal.
There is no difference between the normal and the diabetic diet. Both has certain restriction. The only difference which we would look into a diabetic patient would be more of fiber, more of complex carbs and good amount of proteins, and obviously cutting down the fibers and the quantity. Quantity plays a really important role while planning a diabetic diet. Like how much amounts of rice you are taking or how many quantity of rotis you are taking, that has to be taken into consideration. Rice, maida, bread and bread products, which has a higher impact on sugar, so which we would like to control it. Whereas if you're looking for a complex carbs like oats, bajra, quinoa, so these are the complex carbs. It takes time to digest in your body and ultimately it gives the sugar rise very slowly.